Hi, thank you for joining today. I'm Jaime and I'm ERP therapist at CBT and EMDR. I'm a clinical supervisor. So today is the third video on OCD, and today we are looking at how and a strategy or how to stop feeling anxious, and that is sort of what we call habituation. So if you're living with OCD, you'll know that anxiety isn't just part of the picture. It's often the front and center of the picture, right? It's driven by that anxiety and therefore is classified an anxiety disorder. And for many people, that label feels really painfully accurate. The discomfort can be constant, can be overwhelming, can be deeply distressing. Naturally, when anxiety, fear, or any distress shows up, most people, most of us, all of us, or the majority of us, will try to escape it, will try to avoid it. We avoid, we distract, we do something, anything to bring the discomfort down. That is what we might be thinking about the response, sort of the compulsions. And there is a paradoxical thing on this when we're talking about OCD. The more you try to get away from the anxiety, the more tightly the cycle grips you. Let's take a closer look on that. So let me share my screen with you. Okay, so imagine there is a graph, or imagine there is this graph that I'm going to draw, these two axes. Where this is time, right? And that goes for as long as it takes. And this is your anxiety level. A and X, meaning anxiety level. So that would be 0. That would be right to 100. Okay? What happens is that for many people, this part of it here may be called discomfort, not feeling right, something, right? That it feels. The summary, what that means is that it's not feeling right. It's not feeling good. There is an impact on it. So what happens is when you are feeling that unease, something not being right, the disgust, whatever it is, or something you're trying to walk away, to escape. What you will notice is that starts increasing, and at some point here, we do something so this pain we are experiencing goes down. And it does go down. At some point, there is another situation where that, again, sense of anxiety, disgust, discomfort goes up. And then we do something, as we would do, for it to go down. And it goes down. And that may be something you do for an hour, that may be something for 10 minutes, or for 3 hours. And what it happens is at some point, after you finish, it happens again. And that continues and continues. And I could move this forward, and I can continue and continue. Right? So it could be as long as we will look. Anxiety, disgust, pain, discomfort goes up. And then we do something to keep ourselves safe. Okay? So what that does, that we call it compulsion, ritual, neutralizing act, that's bring the anxiety down. The anxiety down. Maybe you might avoid a situation, you might wash your hands, you maybe checking something or mentally reassuring yourself or mentally retracing the steps. And it works, as you can see. Your anxiety drops. And it makes perfectly sense. These feelings are deeply unpleasant. And of course, you and everyone or anyone would like to get rid of them. Who wouldn't like to feel that? Who wouldn't like to be stopping feeling that way? So, surprising you and anyone else would try to spend a lot of time and energy doing this, trying to reduce the unpleasant feelings. Now, it appears to be a catch, right? The next time when we are facing it, right, here, we need to repeat things, right? And it comes down again as actual. And over time, as you can see, this creates a pattern. And as you see, I can extend the board, the drawing board, as long as I like to. And then the same pattern that goes up and down, that cycle repeating endlessly, where you have a short-term relief, and in the long term, it gets maintained. Apologies. And in fact, there is something called a window of tolerance of distress. This window is very likely to reduce. So what if felt 100% anxiety 5 years ago, now it doesn't feel, with less distress, you will feel as overwhelmed. That's a different video completely, right? So what keeps the OCD going then? So this pattern is persistent and the brain, your brain, never gets the chance to learn that you can get past of anxiety and that anxiety passes on its own, or that the fear consequence might never happen. The compulsion, the ritual, interrupts the learning process, interrupts your natural learning that nothing is going to happen and you can cope with the situation and you can survive, even when it feels so overwhelming. So even though the behavior works in the short term, it doesn't help you to recover. It keeps you stuck. Okay? So you may be wondering, what is the alternative, right? So let's look at a different graph now. So let me move this a bit out of the way. So if we're looking at a different graph, we're doing exactly the same. Those lines, axis. So those axes, there's time, discomfort, anxiety, disgust, urge, not feeling right. However, you need to call it, all right? And that's 100, then 0. 0%, 100%. So what we thinking is, or what we know, is that when anxiety goes up, more often than not, or the majority of the time, anxiety will stay up. It might go down, it might peak again, it might go down, then at some point the anxiety will naturally go down, okay, with time. And instead of performing, so what happens is when this picks up to that point that it feels overwhelming, instead of doing any of these rituals or behaviors, we naturally let it go to the point where it naturally drops. It would drop to a more level somewhere. So the graph is sort of, apologies for the graph. So what we know is that the more you're going to be doing something, the anxiety will go up. And if we do not respond, so in here we are responding, that's your response, or we know that this response, we do not respond here, we do not response there, naturally, that will go in down. And that will happen again. So we do not respond, no responding, no rituals, no avoidance, no compulsions, no mental compulsions. Naturally, that will go down. No distress will go down. This principle is called habituation, right? This very same principle means habituation, meaning you get used to it. You have a habit where the feelings usually fade away. What we know is that with this, your intrusions, your intrusive thoughts also reduce with time, okay? So if you think, few examples, if you were to play an instrument and you played for years an instrument, and you would go to concerts and practice, you are completely habituated, used to play that instrument. If years go by, you'll be finding difficult returning to play the instrument, right? So turning up to a new job, starting university, and so on and so forth, starting to drive, you will initially find anxiety, distress. With time, the more you do, the easier it gets, right? In the majority of the times of the cases, right? And hence, these videos are sort of educational. They're not substituting therapy because you may need different understanding on a full assessment. So what happens is that by doing this, and this is where many people say, well, actually, this keeps my anxiety going, maintained. In the short term, I don't feel overwhelmed and I can keep on with their life. Yes, you're right. What happens is that this is a lifelong. How long are you going to be feeling anxious, responding, going down, responding, feeling down, responding, feeling down? How long? Well, we are sort of inviting people, and we invite them, we give them a choice. This is the other option where we understand that there is a different approach, that in the short term, you will feel more overwhelmed, more distressed, more anxious. However, in the long term, it will pay off. And what we know is this is backed by science, by research, and that's because ERP is the gold standard for OCD. Okay? So you may be wondering, what is next? So the principle is the one we'll keep coming back to in the videos. This is the principle, getting used to habituation. There'll be other graphs or other diagrams that we look, and we will always, if we go back, we will go back to these graphs on this video. And then we'll bring something we call conceptualization or formulation, sometimes called vicious flower or different models of ERP. So it's one model, different drawings of ERP. And for now, I want you to start. I'm going to invite you. I'm not. What we want is to invite. We want to welcome you to decide. I'm going to invite you to think. What do you fear? What happened if you did not perform any of these rituals? The response. If you would not respond to your intrusive thought. And that is one of the keys for OCD. And bringing or beginning change. Okay, so let me stop sharing. So thank you very much. I hope this was clear. It's a bit longer than the other videos. You can subscribe, you can share, you can like, you can comment. If something comes up, we'll answer. Thank you very much.